Hi, my name is Malik Day and I'll be a nurse for the day. And today in this video I'll be demonstrating on how to do piggyback. And as you can see, I've improvised and found a way to make it hang from something. As you can see, the ceiling fan. But anyway, let's just jump right into this. Okay, so the first thing you want to do is you want to check your MAR to check to make sure, of course, that you have the right patient, the right dosage, time, etc., etc. Everything that the MAR needs to show you is going to be right there in the MAR. That's the first thing that you need to check always. And the next thing that you want to check is the compatibility of the medication that you will be given. By checking that, you want to either check it with a compatibility chart. You want to check either call the pharmacy or check a reputable internet source of some kind. Alright, so the next thing we want to do, we want to gather our equipment in which we need the correct medication, in which I have already opened the package to make sure that I see what kind it is and the amount of milliliters that's in it and everything. And then what we need is our kit, which comes with the spike and tubing and the hook. Also on this pack, it has the drop factor, which is 10. You need to pay real close attention to that because you're gonna need that for this next step, which is the calculation. And what I have here, I have Ansef 125 milliliters of it, which will be hanging for an hour. So what I need to do is I need to calculate that into drops per minute, and that's where this comes in to play at, because you need that 10. So what I want to do, got my paper and my pen. You know that you have Ansef 125 hanging for an hour. You want to put your 125 milliliters over not an hour but 60 minutes, because you need it per minute, times 10, because that's your drops per factor. So you would do 125 times 10 over 60. And let me just do this calculation real quick. So 120 times 10, 125 times 10 divided by 60 is 20.8. 125 times 10 divided by 60 is 20.8. But you want to round that and make it 21. So it'll be giving it 21 drops per minute. If you can see that. Alright. So next thing you want to do, you want to open the package to the tubing and everything like that, which I have already done that, you know, just to show what equipment that we'll be needing. Alright, so also in this pack, it comes with an adapter, but you don't need that. So you want to go ahead and attach everything by keeping it sterile. So of course you have performed hand hygiene to make sure that you don't contaminate anything, but you don't want to touch it as well. So what you want to do, you want to grab your tubing, take that off, of course, and dispose of that paper, and grab your medication, pull this covering off without contaminating it, dispose it, pull the cap over the spike off and dispose it, and then push that in there till it connects right there at that lip. Next thing you want to do, you want to prime it. So I'm just gonna hang it right here on this lower one and squeeze this to get some in there, halfway. Make sure that you have it closed before you do this. And then you want to open it, but don't try to waste any out of it because it's your medication. So it's coming down. It's almost to the tip, and we got it. And what you're doing is you just trying to get all the air out of it, and but without wasting any of it because it's medication. Also, while doing all this, you want to check and make sure that you don't have any cloudiness or debris in the medication or in the fluid bag whenever you go into the room and see the fluid bag. So now you're gonna go to the patient's room. So you can walk to the patient's room, knock on the door, and identify the patient, identify who you are. So my name is Malik Dade. I'll be a nurse for the day, blah, blah, blah. Where you state your name and your date of birth so we can make sure that we have the right patient getting the correct medication. And then you're gonna go and wash your hands and make sure you perform your hand hygiene, everything that you are supposed to do. All right, so first thing that you want to do is you have your medication. You want to get your hook and drop down this bag. So you want to put that down lower. Hang it from the hook, as you can see. And you got your tubing right here, which will be actually hanging down. And also, you need alcohol wipes, which I did not mention, but I have them right here. Need your alcohol wipe to clean the connected part, because this has been hanging down and you just don't know what could be in it. So you want to clean this for 30 seconds to get away all debris or whatnot. So you clean that for 30 seconds. Really, after you have done hung that, you want to clean that for 30 seconds. So let's go ahead and hang this. And then you would clean this for 30 seconds while keeping sterility. And then you would unattach that cap, dispose of this, and connect these together. And then adjust this to drop at 21 drops per minute. And then that's it. All right. So now I'm going to show you how to disconnect everything. So you would walk into the patient room, knock on the door, identify the patient, identify yourself. After all of this is done and complete, you would take this off, disattach this. All right. Dispose this to where it needs to be disposed. Grab your big bag, hang it back up high. Get the hook, dispose the hook. And then you would, of course, document. You want to document the time, the procedure that has occurred. You want to document the medicine, and say for instance it's been 4 hours and you needed to just change this out, you document if you've done that. You document how much fluid is left in the fluid bag, and make sure that your patient is comfortable. One thing that I didn't mention, but you really need to do before hooking all this medication up and everything, is make sure that your patient is not allergic to any of these things. I forgot to mention that. But I caught myself. Of course, I would have done that. You ask the patient if they're allergic to anything, because as we know with IV, you cannot suck that back out of them. Once it's in them, it's in them. You can't hurry up and just pull it back out. You can't make them vomit it up. You can't. It's in the bloodstream. So that's it. That's all that we have here for today for the piggyback. Thank you for the time.